Picture this. You're 43 years old. You have not slept properly in months. You snapped at your partner this morning because he or she may have loaded the dishwasher wrong. And yes, you can hear how that sounds. Your period showed up 9 days early after skipping the month before. You're standing in the grocery store and you genuinely cannot remember why you walked in. You think, am I losing my mind? Well, you're not. You're probably in perimenopause. And here's the wild part. Nobody told you it could start this early. Nobody told your partner either. So today, we're fixing that. If you're a woman in this, stay with me. If you're a guy listening because someone you love is going through this, first of all, gold star, stay tuned because this one is for both of you. Welcome back to Prediabetes and the Path to Better A1C podcast. I am Jenny Pena, your host. I am the founder of GenP Coaching, National Board Certified Health and Wellness Coach that focuses on diabetes prevention. And today we're tackling something that affects literally half of the population. And yet most of us walk into it completely blind. Perimenopause, menopause, the transition, the change, whatever you want to call it. Here's what we're covering and what's actually happening in the body, when to expect it, the symptoms nobody warns you about, the wild stuff that happens to your metabolism and your blood sugar, and why GLP-1 medications have become part of this conversation. I am going to share some tips for women going through it and a real talk section for the partners who want to show up but don't know how. Okay, so buckle in. Let's go. Now, let's talk about the basics. What is actually happening? Let's start with definitions because most people kind of mix this up. Perimenopause and menopause are not the same. So let's clarify that. Perimenopause is the transition phase. Your ovaries start winding down production of estrogen and progesterone, but they don't do it gracefully, right? They sputter. Hormone levels swing wildly, high one week, crash the next, right? Like that hormonal chaos is what drives most of the symptoms we'll talk about today. Now, menopause is technically one single day. It's the day that marks 12 consecutive months without a period. That's it. After that day, you're in post menopause for the rest of your life. So when somebody says, I'm going through menopause, what they almost always mean is perimenopause. It's the transition, the years long process leading up to that 12-month mark. Now, here's a timeline that surprises a lot of people. The average age of menopause in the US is around 51 or 52, but perimenopause typically starts anywhere from like 4 to 10 years before that. Most commonly in your mid, it can absolutely start in your mid to late 30s as well. That's not abnormal, it's just earlier on the curve. Now, there's some research out there that found that the average age for perimenopause onset is around 47, but then a meaningful number of women in their late 30s and early 40s are already experiencing some of these symptoms and are getting dismissed when they bring it up to the doctor. Now, quick note on what's driving everything. Estrogen is the headliner, but progesterone, testosterone, and follicle stimulating hormone, I know I'm getting into all these science jargon, they're all in the flux, right? Like estrogen doesn't just regulate your menstrual cycle, it influences your brain, your bones, your blood vessels, your skin, your mood, your sleep, your joints. Okay, your metabolism and your sex drive. So you see why all of these things are just changing and how it feels so overwhelming? Well, when estrogen starts fluctuating and dropping, everything it touches gets a little weird, which brings us to the symptoms. Now, I hope that this brings you clarity as to, okay, this is why it's happening. This is what is happening. Now, let's talk about the symptoms nobody warned you about. Everyone knows about hot flashes. Hot flashes are the celebrity symptom. Now, they get all the press, but yes, they're real and they affect roughly about 80% of the women. Now, the sudden wave of internal heat, night sweats that soak the sheets, cranking the AC while your partner is wearing a sweatshirt, right? Like all of these things. Now, here's the thing, there's a whole roster of symptoms that nobody mentions, and they often show up first, years before the hot flashes ever arrive. Now, let me run through them. If you're a woman listening, you might be checking off a list right now. If you're a partner, pay attention because this is the stuff that often gets misread. Here are the sneaky ones: brain fog, forgetting words mid sentence, walking into rooms, struggling to focus on things that used to feel so easy. This isn't early dementia, this is fluctuating estrogen affecting cognition. Another one, rage. Not just irritability, but actual rage, disproportionate, out of nowhere fury, right? Like estrogen helps regulate serotonin. So when it drops, the emotional brakes get loose. The other one is anxiety, especially when anxiety in women who have never been anxious before, often worst in the days before a period. Joint pain, right? Like having aches in your knees, hips, hands. It's sometimes called menopause arthritis, right? Like then estrogen kind of like has that anti-inflammatory effect, and losing it changes how your joint feels. Then you have the frozen shoulder. Look this one up. It's strangely common in perimenopausal women, and most people have no idea it's connected. And guess what? Side note, I had it, and I'm actually getting a lot of PT for it. But that's a side note. Now, heart palpitations, that flirty, racing heart feeling, often at night, almost always benign, but terrifying if you don't know it's a thing. Then you have the sleep disruption. This I hear all the time from my clients, not just from the night sweat, but it's technically waking up at 2 or 3 o'clock in the morning every single night and being unable to fall back asleep. This, my friends, is hormonal. Then, sorry, I'm going to have to go there. Vaginal dryness, painful sex, low libido. We don't talk about these enough, and they're often the symptoms women suffer with longest in the silence. Then you have the hair thinning and the dry skin and the brittle nails and the mood changes, right? Including even elevated risk of depression during this transition. So here's what makes it so disorienting. These symptoms come and go. Some weeks you feel fine, then a week later you're crying in the car for no reason. It's not consistent, so it's easy to almost gaslight yourself into thinking nothing is wrong. But guess what? Something is happening. And it has a name. Let's talk about now metabolism and sugar and weight. Because you know that I focus on diabetes prevention. And a lot of women that are coming to me with a diagnosis of prediabetes, they're also struggling with all of these things. So let's talk about this. I'm doing everything I did before. Why is my body changing? Why am I gaining weight? This is real, it's not in your head. Here's what's happening biologically: estrogen drops. When that happens, there are three big metabolic shifts. Where your body stores fat, it changes. Now, estrogen historically directed fat storage towards the hips and the thighs, right? Like that's what we like, the Coca Cola bottle shape. But when it declines, fat is going to shift towards the place that none of us want it, the midsection, specifically visceral fat, the deep belly fat that wraps around your organs. This is not just cosmetic. You could actually don't look like you have visceral fat, and yet you do. And this is metabolically active and raises your risk for heart disease and also for type 2 diabetes. Now, the second thing that happens, you become more insulin resistant. So your cells kind of stop responding to the insulin as well as they used to. That means the carbs and the sugar that your 30-year-old self could eat without any consequence now spikes your blood sugar higher, and now it keeps it elevated for longer. And then if you have been listening to my podcast, you know I talk about this all the time. That spike and crash pattern is what drives those 3 p.m. energy collapses. And that spike and crash pattern is what drives those 3 p.m. slumps, the sugar cravings, and the 2 a.m. wake ups. Because your blood sugar is dropping in the middle of the night and can literally wake you up. Now, the third element, muscle loss accelerates. Hashtag flabby. Estrogen helps maintain muscle mass. And as it drops, you lose that muscle faster. And muscle is what burns the calories at rest. So even if you're eating the same amount, your engine is running a little smaller. And then when you put those three together, think about this: muscle loss, insulin resistance, belly fat accumulation. What do you think is going to happen? And this is why the old advice of just eat less and do more cardio is just not working. It often makes it worse. And cardio without strength training accelerates the muscle loss. So here's what I would say that helps: strength training, twice a week minimum. That is a non negotiable. This is the single most underrated intervention for women in perimenopause. I personally do not like strength training. I'm going to be very honest here, but I had to focus on it, and I have been focusing on it. Protein at every meal. This is something that I tell everybody. Please, most women are underrating their protein needs. Aim for roughly 25 to 30 grams of protein per meal. Assess. Most of us actually need a bit more than that. Great place to start. 25 to 30 grams of protein per meal. Watch your blood sugar swings. What do I mean by that? I always like to say do not eat carbs naked. Pair the carbs with protein and fat. Eat the salad before the bread. Walk at least 10 minutes after meals. It will blunt that glucose spike dramatically. Again, a lot of these simple shifts, you may think that they're so tiny that they have no impact. They impact your blood sugar the most. The other one that, sorry, not sorry, limit alcohol. Alcohol is going to disrupt your sleep. It will make hot flashes worse, and it hammers your liver's ability to clear those hormones. It adds empty calories. Again, the body is going to then put all the food on storage mode, and storage is fat. And then when you think about the cardiovascular risk that goes up after menopause, again, estrogen is that protective element that was more abundant before. And once it's gone, women's heart disease risk climbs to match men's. So again, all of these things matter. Hopefully, I'm not scaring you, but it's more about bringing awareness. Now, let's talk about GLP-1s. You know that I coach individuals trying to lose weight and manage metabolic health using GLP-1s as well. But a lot of people think of GLP-1s as that magic wand. It is not. GLP-1s are a tool. And this is going to bring a conversation that maybe didn't exist 5 years ago, right? They were not trendy. And you have heard the names: Ozempic, Wegovy, Mounjaro, Zepbound. Originally, they were developed for type 2 diabetes. Now they're widely prescribed for weight management and increasingly for women in perimenopause and menopause. Now, the quick primer on what they do is that GLP-1 mimics a hormone your gut naturally produces. So your body does produce GLP-1s. This hormone slows the digestion, regulates insulin response, quiets down what people are calling food noise, that constant background of what am I going to eat next? I want something sweet. That voice, that is what now has a name, is called food noise. Why are they coming up so much in this menopause conversation? The reason why is because they directly target that metabolic stuff that we just talked about. They improve insulin sensitivity, they help reduce visceral fat specifically, they quiet the hormonally driven cravings that ramp up during this transition. And then for a lot of women, it's a really good tool that finally moves the needle when nothing else has. But I do want to note this, and I'm very vocal about it. And some people were like, oh, you coach people using GLP-1s. Why it seems like you attack it so much? I don't attack it. I want to bring awareness and I want them to be used appropriately. GLP-1s are not a magic shortcut. They work best when they're paired with strength training and adequate protein and managing a lot of other lifestyle habits. If you take them and don't lift weights or eat enough protein, you will lose weight, but you will lose a significant muscle. That's the worst possible outcome for a woman in midlife because you need that muscle for the next 40 years of your life. Then you think about the side effects, the nausea, the GI stuff. These GLP-1s are not a free trade off. And I'm not even going to get into the cost or the access that are real barriers depending on your insurance, depending on the country that you're in. And are they right for everybody? No, they're not. Are they right for some women in perimenopause? Yes. And this is genuinely a conversation that you should have with a doctor that is well informed on this topic of perimenopause. Okay? Not your annual checkup that it's only going to give you like 10 minutes to cover your entire medical history for the past year. A doctor that actually understands the stage of life, a s- an appointment that is going to cover this. Make sure you do that. And a bigger point that I want to make, we have spent decades telling women that midlife weight gain is a willpower problem, that something is wrong with you. I'm here to tell you it's not. It's hormonal, it's metabolic. And if there's a medical tool that addresses that hormonal metabolic reality, using it is not cheating. A lot of people are against. I have been messaged a lot because of the type of content. And mind you, I am not very forward with GLP-1, but I'm not against it either. I believe it is a great tool for the right people used the right way. And I do have a GLP-1 program to optimize the results. If you need any more details around it, send me a message. Let's continue. What are some tips for women going through it? First, track your symptoms. Use a notebook, use an app, notepad on your phone, anything. Write down what you're feeling, when, how it lines up with your cycle. That can give you a lot of insight. And when you go to the doctor with, let's say, 3 months of data, you walk in with power. You're having data to really go through what is happening so that you don't get dismissed with the your labs are great. The second, find a provider that is well informed with menopause. This is huge. A lot of general practitioners, they had probably less than 2 hours of menopause training in medical school. I'm sorry, doctors, we love you, but that is the truth. You want someone that understands menopause, who has actively built a practice around midlife women's health. And now telehealth has made it so much more accessible. So make sure you get a great practitioner. And third, assess your treatment options. I am a health coach, I'm not a doctor. I am sharing all of this for information. Please do not embrace anything without talking to your practitioner because I don't know your medical history. I'm not a doctor, but I want you to be informed. So, here are some treatment options that I'm going to mention so that you can do your research and go to your doctor well informed and make an educated decision around this. Hormone replacement therapy. There was a lot of misconceptions about it, worth looking into because replacing the estrogen and the progesterone your body's no longer making, it may be an option for you. Vaginal estrogen. It's like a separate, very low dose, very low risk treatment, specifically for genital and urinary symptoms, right? It's actually a bit underused, but there are some people that will go that route. Again, talk to your doctor. There are also Non hormonal medications like some antidepressants, they may help with hot flashes. There are other drugs that are used for night sweats. So, again, talk to your doctor, do your research. And then you have the lifestyle and the behavioral activities that you can incorporate: strength training, getting adequate protein, sleep hygiene, cognitive behavioral therapy, mindfulness. These are not substitute for medical treatment, but they stack and they help you. Now, fourth, and this matters for you, be compassionate to yourself. You're not broken, you're not failing. Your body's just going through a transition that is just as significant as puberty. Only this time you're an adult with a job and a family and no instruction manual. So give yourself some grace. You you would give a teenager going to puberty. Okay? Like you deserve it. Now, for the partners, I promise that I will talk about this. This session is for you, the heroes that have to endure and support, right? It applies to anyone. Now, educate yourself. Don't make her teach too much. She's already exhausted. She's confused. She's Googling her own things at 2 o'clock in the morning when she wakes up because of that blood sugar and hormonal fluctuation. So, the most loving thing that you can do is learn the stuff independently. Read a book, listen to a podcast like this one. You're already getting some education by listening to this podcast. Hand her a glass of water and say, I've been reading about this. I get it now. She's going to feel very well supported. Number two, please, please do not say this. Please do not say this. Is it that time of the month? And asking it makes you the problem that moment. Okay, so just don't do that. You're overreacting. Trust me, she knows. She's already mad at herself for it. Don't pile on it. Or this is worse. This will hit in the heart. You used to be more fun, chill, sexual, patient. You know, now she's also sad after listening to that. And the other one, please do not use this one. Have you tried just relaxing? Take note of this. Your partner will appreciate that. Now, number three, practical support, right? Small things matter greatly here. Keep the bedroom cool. We know the hot flashes and all of that. We know that probably you're freezing, but keep the bedroom cool. Keep a cooling mattress pad. Get her one of those bedside fans, something that is going to help her manage the whole thing. Pick up slack quietly, right? If she's exhausted, is brain foggy, go do the dishes, make the appointment, buy the groceries, right? Like pick up some of these things. Don't announce it like a press conference, just do it. Watch her sleep. Encourage it, protect it, prioritize it. Because sleep is the foundation everything else rests on. And if you don't sleep well, your hormones, a lot of other things are happening. And be patient with intimacy. It does change. And painful sex is real and is common. Low libido is also real and common. And the fix is not pressure, it's more communication, sometimes treatment. It's rebuilding that intimacy in a very non sexual way while the physical stuff gets addressed. Now, number four, strategy: go to appointments with her. This is huge. Two brains in a room. You can ask the questions she's too foggy to remember. You can take notes. You become her advocate. And women routinely report that having a partner in the room changes how seriously they get taken. So that is also very important. And then number five, take care of yourself too. You are probably in midlife as well. Your sleep is changing. Your friends need investment. Your body needs strength training. If you're a wreck, you can show up. So take care of yourself too, so you can be present for her. And the frame I want to leave you with, this is not happening to her with you as a bystander. This is happening to both of you. And the couples who come through this with the deepest connection are the ones who treat it like a shared project. So see it like that. Now, one last thought before we wrap up. I know this is a long episode, but it's worth. There's a story we've been told about menopause that it's a decline, that it's the beginning of the end, that women become invisible after it. That story's garbage. What the research actually shows is that many women describe their post menopausal years as some of the most powerful, freeing, and self assured of their lives. The brain fog is going to lift. The interest in pleasing everyone is going to fade. And what's left is that person who finally has the energy and clarity to do what they want. The transition is hard, and the destination, I have to say, it's often extraordinary. So if you're in it right now, you're not in decline, you're in transition. And transitions are temporary. Now, the work you do during this stage to take care of yourself, to learn, to communicate, to get the right medical support, that's the foundation for the second half of life. It's worth doing well. Now, as we close, perimenopause is a long transition, usually starting in your 40s, sometimes earlier. Menopause is the single day marking 12 months without a period. The symptoms go way beyond hot flashes. It can cover brain fog, rage, joint pain, anxiety, sleep, and your metabolism changes in real ways. Insulin resistant, visceral fat, muscle loss. And those changes are biological, not behavioral. So, tools like HRT, vaginal estrogen, non hormonal meds, and yes, even GLP-1s when appropriate, they all have a role. And partners, your job is to learn, listen, and show up. If this episode helped you, share it with someone who needs it. Maybe it's your sister, maybe it's your friend, your partner, your group chat. That's how we get this information out the dark corners and into the conversations where they belong. Now, next week, I have a practitioner that specializes in perimenopause and menopause coaching. And I am looking forward to hearing everything that you're going to learn and get the feedback from you when this podcast is released. So be on the lookout and take care of yourself. Take care of each other. It's worth it. Until the next one, bye.